for joining us, Trisha, and seeing how we can help you. And so far, everybody in the group is getting some kind of results. Some are getting better results than others. It's just everybody is different. Some people can get off all their medications in a couple months. Some people need a year or so to get off their medications. So it all depends on how much dedication you are to getting healthy, and it also depends on your biochemistry. So, and that's different for everybody. But fair enough to say that everybody in the group has gotten better, has gotten healthier, and some results. Okay, I don't think anybody's been in the group for longer than 2 months has not gotten any results. So the thing that we have here is I do the educational side, the science behind it, and the workout sessions because of my background. My brother's a professional chef, so he comes on once a month, and most people don't want to cook because they might feel intimidated. They don't know how to cook. They don't know what they're doing. So my brother tries to make it very simple ingredients, makes the menus simple, and everybody follows along. So what we do is we give the ingredient list and the cooking instructions to you a couple days before the Wednesday that my brother is on, and then we all cook together so that if you have any questions, you can ask him. Plus, we'll talk about the nutrients and stuff and the foods and everything that we're working with. We also stress management is huge. That's going to help out with your blood pressure. It's going to help out with your glucose levels. And overall, it'll help out with your circulation, respiratory as well. So we have a lifestyle coach, and she does meditation, she does yoga and visualization and breathing techniques. So we incorporate all these things that really encompass a healthy lifestyle in this program. And you might not be getting it every day, but what Jovi does is she records it and she sends the link over to you. So if you want to do yoga every day, right now we just started doing this maybe about maybe 5 or 6 months ago. So we're kind of building a library, and you'll be able to choose different ones. But right now we only have maybe about 4 or 5 different routines with that. But it's enough to get you through the week for right now until we get more into the volume that we're doing. I assume Jovi sent the overall of what type 2 diabetes is.
Yes. Yeah, I've been really busy the last few days, so I'm kind of a little behind on Jovi's emails.
Totally. The big picture is this isn't a blood sugar disease. It's an insulin disease. So blood sugar is just a symptom. So it's sort of like saying that your runny nose is a cold. And it's not. It's just one of the many symptoms that a cold is. So your blood sugar levels is something that they have. They try to keep you focused on that because of the pharmaceutical industry is making so much money on it. It's I'm in the process of writing a book about reversing diabetes and just looking at statistics and everything. In 2017, diabetes brought in $247 billion for the year. So it's a huge money maker. And if people knew that they can get rid of the disease and how to do it, it would probably wipe out the healthcare system for a while. It'd be a huge crush to the system of all the money that's involved with this, because it's not just the medications that you're taking, it's the amputations that get involved with it. It's the heart attacks. 75% of type 2 diabetics that die, they die from heart attacks. So it's heart attack, heart procedures, strokes, amputations, neuropathy, liver disease, kidney disease. And the reason why all these diseases happen is because, and cancer too. So all these diseases happen because the sugar is not leaving your body. It's what they're doing is sugar is being stored in your fat cells. And when your fat cells in one fat cell, it can't push any more sugar into it, what happens is that a new fat cell grows so that more sugar can grow in there. So all these fat cells start going into your pancreas, which causes the type 2 diabetes. So if you get rid of the fat from the pancreas, you can get rid of the diabetes. The sugar goes into the heart, giving you heart attacks. It goes into the liver, giving you fatty liver disease. It goes into your kidneys, causing kidney disease. And so this is why type 2 diabetes has so many different diseases that are involved with it because of all the. So we need to get the sugar out of you. And the only way we can do that is to stop putting it in you and letting your body use the sugar that it already has in you as energy. And the only way we can do that is to go against the status quo and stop eating the way that they're telling you to eat. You're not supposed to be eating all the carbs that you're eating. You're eating the carbs so you can keep on the medications. If you were taking those medications and you weren't eating the amount of carbs that they're telling you to eat, you go into a hypoglycemic state. And then you can go into a coma and you can die. So you're actually feeding your drugs so you can keep your drugs. So we need to get a vicious cycle that you're in, that the system put you in.